Ladies and gentlemen, welcome to this week's episode of What the Health Just Happened, where we talk about all things healthcare, community, business, and life, the goods, the bads, the ups, the downs, the lefts, the rights, and everything in between. Oh my gosh, we are so fortunate to have on a variety of guests way smarter than we are to share their life and industry expertise and educate us and maybe laugh along the way, hopefully. Today, by the way, is no different. I'm excited. I hope you are. We'll see. I would say, I wrote this down, a true Jacksonville community advocate and leader. Legend. I'm going to call you a legend. I think you're a legend. CEO of Volunteers in Medicine since 2018, right?
Yes.
Wow, time flies.
I know.
I wrote down Jennifer Ryan, but on LinkedIn, there's a Gornto?
Yes.
Is that the maiden name?
That's my maiden name.
Okay,
yes.
So what should we call you? Jennifer Ryan?
You can call me Jennifer Ryan. Yeah. Yeah.
Do you prefer Jennifer, Mrs. Ryan, Dr. Ryan?
Well, I'm not a doctor, but
Okay.
that does sound good.
We'll get to doctors.
Just not Jenny. That's what I tell people.
Just
You can
not
call me
Jenny.
Jen, Jennifer, Gornto, Jago, but just not Jenny.
Jago.
We love nicknames.
I know.
Jago's fun.
It's fun. Yeah.
I might start calling you
Just
that.
not Jenny. Because my husband is J. Rye. So he can't
J-Rye?
be.
Oh, that's
He
good
can't
too.
be. Yeah, I can't be J. Rye.
How about flying with Jen Ryan?
Jen Ryan sounds great.
I like rhyming. Terrible rhymes.
Jen
I'm
Ryan.
sorry. Okay, so 2018, Volunteers in Medicine. Let's start real quick. What is Volunteers in Medicine? I think it's an incredible organization doing special stuff. Your version.
So Volunteers in Medicine is a free clinic for the working uninsured. We provide primary care and 16 specialties with the help of over 300 volunteers a month.
We're going to dive into a lot of that stuff. Oh, Trey's ready.
Is that
already.
all in Duval County, or does that even exceed
Anyone
further?
that can get to us in Northeast Florida.
Wow.
Yeah.
What if someone's in South Florida, like Boca Raton, visiting Jacksonville? Can they come?
So our patients, they have to qualify. So usually someone visiting, what we would do is we might recommend a local clinic for them to go to back in their community. There are other clinics like ours around the state. So we would recommend them go to a place closer to home because we really want to be their medical home where they come to get their mammograms, their colonoscopies, just get their eyes checked, get basic lab work on a routine basis versus just coming in and seeing us one time.
All the things. You
No,
ready
that's
already?
good. So you're getting it from Clay County, Duval County. What's the furthest?
Baker, the
what's
Big Five.
Could you at least tell me the furthest someone's ever come?
South Georgia. We
South
had
Georgia,
someone
all right.
come. Yeah.
Nice.
It's only an hour away.
Okay, that's not
It's
far.
not far. Yep.
Revenue base. I wanted to start like a little personal journey and story, then Volunteers in Medicine, but we're going straight to Volunteers in Medicine. It's VIMJax.org.
Yes.
Okay,
That's our
we're
website.
going to hit that a bunch. I want to read this. Went to the website. I love cool mission statements. Can I read it?
Yeah.
Our mission is to advance the physical, mental, and emotional well-being of the working uninsured to improve quality of life.
For all.
For all. I left that part out, but just think about it.
For all.
Do you have health insurance? Yes. Do you have health insurance?
Yes.
Do you have health insurance? Yes. Do you have health insurance?
Yes.
Okay, so you all don't qualify for this. How many people don't have health insurance that are working? A lot.
Over 80,000 in our
Jacksonville.
community in Jacksonville.
Or Northeast Florida. 80,000 people we'll talk about. City
That's
of
that are
Jackson
working. There's over 130,000 uninsured total in our community.
Okay. We're going to go back to Volunteers in Medicine. I want to share some stories first. You went to Emory first.
I went to Mercer University
first.
in Macon, Georgia first.
Mercer
Yes.
first to play volleyball.
Yes.
Oh,
What
wow.
were you studying?
My undergraduate degree is in environmental science.
Did you want to study that? Like you told me that we talked about this before, but you grew up like, I want to go into environmental science, or you want to be a lawyer.
I started with psychology. I thought I was going to go to law school. I was very bad at psychology, very bad. I'm more of a science. It's very philosophy.
Yep.
And I'm more of a factual data
Numbers.
evidence person.
Yep.
So I went more towards the science route. And so I thought, I could work for, companies that are doing well for the environment and become a lawyer. And not sure what happened. I did not end up becoming a lawyer and moved to Atlanta after and actually worked for, did some environmental health and safety in a manufacturing facility. And then went to Emory to get my master's in public health, where I really grew to love public health, and I've carried it with me all the way to this position. But that was in environmental and occupational health.
The master's.
My master's was in. So
you go to college. I'm going to be a lawyer. Were you playing volleyball for the school, like intramurals? What kind of volleyball are we talking about here?
At Mercer?
Yeah.
So I played, it was a Division I volleyball program that I was on the team.
Scholarship?
Yes. I was a recruited walk-on who then got a scholarship second year.
Competitive, right? Wants to win. True or false?
I do, but I've learned to soften it a little bit because I have nieces and nephews that I'm trying to set a good example for.
Got it.
Do you still play a little bit?
I do. I played beach volleyball.
Oh,
We're getting
right.
there.
What a good
We got-
workout.
hey,
When
Oh,
you get older,
cow.
you got to move to the sand,
sand.
because the floor
Body.
gets a little hard on your joints, and so I
So
don't hurt
moved
myself.
to Atlanta, first job out of college. Did you just take a job to take it? What was the manufacturing facility
I worked for them in a consulting capacity.
doing?
It was helping manufacturing companies managing. It was just terrible and boring and
I
horrible.
love it. That's what I want to hear.
It was just so bad. I was writing these plans for air pollution control, and it was just not good. And so that's when I applied for my master's and then I applied for a job at the CDC, kind of an entry level, the Centers for Disease Control and Prevention, and started there with just my undergraduate degree, and then they supported me in my master's.
So simultaneous, you moved to Atlanta for a job that sounds incredible,
It was
Awful.
not.
Wink, wink.
It was not
Boring.
fun. It was not fun.
and then I'm going to get my master's. CDC is funding this. Is that
Yeah. So they helped support me through it, and I worked in HIV and AIDS prevention, and that kind of started my path to get to where I am, to understanding public health, understanding populations and things that impact populations. So it was in HIV, but a lot of the principles of public health you can carry to other diseases, diabetes, hypertension. But that kind of started my trajectory in mental health, or in maternal and child health.
What would you recommend? Again, we just met. I'm calling you out now. So going to school, getting a master's, working one job, then taking a job elsewhere, like advice for young people that are in school, this job sucks. You found your way to a really cool company we'll get to, but
What I've learned in my career, and I love to give these talks, I love to
Yes.
mentor and talk
Yes.
to people, is sometimes your job and the people you work with guide you to where you're supposed to be. That you might think you want to be one thing, but you're not good at it. And that's what I learned. The things that I didn't like, I also wasn't good at. And so I wasn't a good worker. I wasn't performing and getting work done in a timely manner because I didn't like it.
because you were miserable.
I was miserable.
Okay.
And so I think people that are in these jobs because they're like, oh, it's a lot of money, or oh, my mom told me I have to do this job, or this is what I'm supposed to do. My parents have done this. Listen to what people tell you you're good at. Listen to follow your heart when you do something and you really like it and it's fun. Like, I really love talking to people. Like, this is super
Yes.
fun right now. And that's my job. Someone told me, I don't want a desk job, or you have a desk job. And I said, no, I don't. I just talk to people all day, whether it's on the phone, through email.
Yep.
And I like doing that. And I like meeting new people and sharing the mission of the work that I'm doing at Volunteers in Medicine.
What do you think about, so a lot of people say, like, improve your weaknesses. I'm a double down on your strengths. What are you good at? How do I double down on that? Do you agree? And
I
what would you
do.
say, like, strengths versus weaknesses professionally?
I think the thing that along those lines for me, how that speaks to me, what you just said, the thing that scares me the most is the thing that I think I should do. Public speaking. This used to be like
I
the
love
scariest
this.
thing
I love this.
in the world.
Number
like, I
one
used
fear
to
in the
be so
world.
scared.
Number one fear in the world is public speaking.
But when you run a nonprofit, you have to be able to speak to people, and you have to get the word out about your mission and have people hear, because you want to make a positive impact on people's lives. So anytime I'm like, ooh, I really don't want to do that, I have to do it
You lean
because
in.
because you just do it, and it's usually, unless it's something
Dumb.
Yeah,
dumb or
yeah,
stupid,
yeah, yeah.
illegal.
Correct. Yeah,
Illegal.
no illegal.
But when it comes to your job, like, it's that phone call. And
I
then,
don't want to call this person.
Yeah, you're nervous.
But
right?
I need to
Ooh.
call this person.
Like, I might need to talk to a donor, and I'm like, I'm going to have to ask them for money. But it's do it right away, as quick as possible, because the more you delay what scares you, it gets worse. Or delay, just like bad news.
Yeah.
The more you delay
Let me
it.
sit on this. Don't tell a white lie that turns into a giant lie.
Yeah.
Go ahead, Trey.
Oh, no, it's just funny. My mom always used to say, like, you should apologize almost immediately sometimes 'cause it's just easier to apologize to someone once you immediately than kind of letting it linger. Anyways.
Yeah.
This is good. We didn't talk about this yesterday on the call. I want to go back to a little stuff about you. Like what you do for fun, how your career path ended at this point. Loves fitness and wellness, beach volleyball we talked about.
Yes.
So court volleyball off the table.
I'm too old. It hurts.
Knees,
it
ankles?
Hurts. Knees
Yep.
and ankles.
Yep.
But man, I can jump so much higher indoors though.
Good point.
Yeah. But
I definitely up here, I'm still
hurts.
mid-20s. Everywhere else, I'm way older.
100%.
Yep.
Yeah. Oh yeah.
Let's talk about weights, because I like this conversation. People, especially women, are intimidated by weights.
Yes.
They don't want to get bulky. They're scared of lifting weights. You said, I love lifting weights.
I love it.
Let's hear it.
I love it. I've been doing F45 a lot lately.
Yes.
Because
Which
my
location?
things, I either anywhere at the beach, Ponte Vedra, Beach Haven, Hodges, Kernan,
We love
Jack's
shout
Beach.
outs, yes.
Any one of those.
F45.
I love
that.
F45.
Yep.
The weight stays I try to go to, and I like variety and change. I don't want to do 4 exercises.
Same thing.
I want to
Bench
do
press,
like 9 to 12
curls, yep.
things, and I want to be done in 45 minutes. I want to move on. I want to be in pain, but I want to move on.
This is a free plug for F45, because I did a couple, I did a free session,
Oh, really?
and immediately I was like, I love this. I've not joined yet. They are diabolical salespeople, by the way. They have my doubts on it.
they're
Gosh.
but they're really
Blow me
nice.
up. Agreed.
They bother me because. Not bother me. They reach out to me a lot because I'm on ClassPass. So I do. That's why I bounce around.
Got it.
And they want me to just be
Yeah,
one
you
location.
get the
And I'm like,
calls.
because I like to throw in yoga. I think some meditation and some stretching
All the
is
things.
always important too. So
I like this. So being uncomfortable. There's a salesperson at F45 that I've asked, like, do you want to come work for my company and sell what we do?
So good.
Yeah. You're so good. So you rotate. I love this. Weights, hiking, walking, volleyball. But the weights thing specifically, I feel like women are intimidated by lifting weights.
I think as we get older, your bone density gets lower in women. And so it is important to do increase your weight bearing exercises. And so I've just really, and my husband loves lifting weights. So it's really fun to do that together.
Yeah.
And during COVID, he was like my inspiration on, okay. And he's always like pushing me, I'm going to put some more weight on this, or I'm going to, so.
Does that work?
Yes. Well,
Because when I
tell
tell
him
my
that.
wife this stuff, she's like,
I get mad
move
at him.
out, Dave. Sleep on the couch tonight.
Yeah,
I'm
I get
kidding.
mad at him, but
Okay.
then I'm like, okay, let me try it, and then if I can't do it, we'll take it off. And so
Do you challenge him in yoga, the other stuff you do, or walking or volleyball? Like, can you beat him in volleyball?
I can beat him in volleyball.
Will he play?
But
or
he will
no?
not ever admit this, and if he ever heard this, he would be very upset. But
We're gonna send him this clip.
He's very competitive. He's
He
very
is?
athletic
Oh, I love
and very So he's very quick, and he was a college athlete as well. So it's fun. We're
Very
never on the
competitive.
same team, so we're always playing against each other. And
That's
and
a healthy or
it's-
not
super
healthy, by
and
the way.
it's-
Bring that back up.
And it's always, I tell my team, we have to win because I have to listen to this when I get home.
I love it. That's right. So the dynamic of healthcare, all these things, there's medications, prevention, treatment.
Yeah.
I think the biggest thing, like, how do you save money on healthcare? It's by taking care of yourself as much as possible to not need healthcare. And what we talked about, you're doing all these things, cooking too. You love cooking, right?
Yes.
Healthy food, or are you frying chicken and I love
Healthy
fried
food.
chicken, by the way.
I have celiac disease and Hashimoto's. So we are gluten-free, dairy-free, make every meal from scratch. My husband and I both love to cook, and he's probably a better cook than me, but we're both good cooks.
Don't give
so-
him that. Don't
I know,
give him that.
he's
skill to
I
have.
am way better than
If
he
you
is at
want
cooking.
someone to cook for you, you have to tell them they're really good.
Oh, I
but he
love
is
it.
a really good cook. He is a really
Mine's
good
the
cook.
the
and I'm
dishes
thankful.
dynamic, right? If you cook, I'll do dishes. If I cook, you do dishes.
Yeah,
Get that rule?
there's definitely an equal household. We don't have children, so it's like we just help each other whatever way there is. I'll do
like
yard work,
that.
he'll do indoor. Like
Team mentality.
We're in a team.
That's
Yeah.
good stuff.
Yeah.
So the diet part. You said you love walking, right? You love.
I love going for a walk. It's
Do you
so
ever-
nice.
Do you ever ruck? Have you heard of rucking?
I
You know
have
what
heard
that
of it.
is?
I've never done it.
So rucking, I used to like running, but it beat my knees and ankles
Yeah.
up. Cannot
Yeah,
run.
can't run anymore.
Unless it's
Hurts.
sports and fun. Rucking, this local company called Go Ruck that has
Yeah.
exploded. You're essentially wearing a weighted backpack. So it's strength training, cardio, and you're walking. I love rucking now. That's a free plug for someone else, by the way.
Yeah. I need to try it. I've heard good things.
Put some weight in a backpack.
Yeah.
Walk. Go ahead.
Meditation. How
Ooh,
often?
Well, when I do yoga, I meditate. I don't really, I try to sit and read or just not look at my phone. I need to be better about meditation. There are so many wonderful benefits to it. But I do, when I do yoga, at least once a week, I use it as a form of meditation. But I know, and Mayo is now doing this whole research and coming out with all this stuff
Longevity
about
department starts.
they're
Yep.
doing things on mindfulness and how it improves your health and diabetes long term and a whole bunch of different conditions. So I need to do it more.
Is there a form of exercise you have not done you want to try out, but are like, I'm scared of that?
I don't think there is.
I'm saying
I've tried I haven't done lacrosse. I've never played lacrosse.
That's a sport too. Like I love that you lift weights. A lot of women are like, I don't want to lift weights because it's lifting weights. And for years, lifting weights was men, bench press, right?
Or you'll
lat
get
pulls.
bulky and not look
Yes,
feminine, and
yes.
it's not true.
But again, as all of us age, your bone density decreases, your strength decreases.
Yeah.
I think it's better than running.
Yeah.
I'll never run a marathon. Would you run a marathon?
I mean, if I needed to, I'm sure I could.
Like, what do you mean? Like running from a
Like,
lion? What do you mean?
I'm just saying.
I
You're
couldn't run a
saying,
marathon.
could I run a marathon? Yeah, I think I could.
Right now.
Give me a little training. I think I could. I'm a little guy. I feel like we're at an advantage being a smaller individual that, I can still run. If I
I
needed
don't
to.
know. I like
think
long
could.
strides.
Give me 6 months.
Can I ask, how tall are you?
I'm
Is that weird?
5'11".
5'11".
Not weird.
Damn it.
I know, you got to
Dang. 5'8". Yeah.
5'6".
Little guys.
Yeah.
I love it. Okay, we'll transition here to volunteers in medicine. I like this, all this stuff that you're doing. Do you take this to work and share with your team and volunteers or the patients walking in the doors? Like you're healthy. We say #healthy all the time. We got hats and stuff, but
It's something we talk about as a team. Like having snacks. We're volunteer led, so we have every type of snack. And so when I started, I just recognized we did not have a lot of healthy options. So
what
I'm
were
like,
the options
we need.
before?
So
when
it was
you
like
started?
sodas and then diet soda
Potato
and
chips.
then potato chips. So we've now
Trash.
added nuts and we've
Seeds.
added like the seltzers and
Yep.
sparkling waters that are flavored that just don't have all the sugar. But we're always talking about health. So somebody's, looking at what someone's eating and then they're talking about, I'm doing keto today, or our
Today
medical
or
director.
long term? You can't do one day of
I know,
keto.
I know. I know.
Okay.
I don't know. We talk. I talk without. I try not to judge other people's health.
Yep.
I do what's best for me.
But
I
reinforce
do
healthy habits.
make sure my mother eats healthy. She's 73, so I'm
Where's
always
Mom?
judging what she eats. In Julington Creek.
Julington Creek. What's
Yeah,
Mom's name?
She's close by. Susan.
Susan. Hey,
Shout
Susan.
out.
We love shout outs. Hi, Mom. I love my mom. Every show.
I'll send it to
love
her.
you,
She'll
Mom.
love it.
Yes.
She'll love it. But our medical director, she loves walking, and so she's always,
I think I wrote
leaving.
her name down. What's her name?
Dr. Vicki Finley.
Dr.
She's
Vicki
always
Finley.
going for walks and will bring a volunteer. And
Yeah.
I think the biggest thing that we do as a team and with our volunteers and everyone is we are addressing one of the key health issues, that's loneliness and being engaged and having a purpose. So we bring that not only to our volunteers, that a lot of them live alone. We've got some that are widows. This is their companion. This is their time for camaraderie. They're
starting early. I
living
love
with
this.
a purpose. So they're helping our patients, but they're also improving their health and staying connected. We always pair them with other people. So they're chit-chatting about travel or what they're going to cook for dinner and then reminiscing about travel.
I love
and
this.
So
300 plus volunteers, right?
Yes.
Variety of physicians, nurses, CNAs, desk individuals.
yes.
They
Yes.
come in, give their time, which that makes you healthier. If you don't volunteer, add it to your list.
Yeah.
Then you build a community of other people doing the same thing. So
Yeah.
to me, it's like a win.
Yeah,
And
we
then the
think we're
patient-
just here for our patients, but we're actually building the health of our
Everyone.
senior population at the same time.
What are the ages of patients? I'll call them patients, clients. What do you call?
Patients, yeah.
I think so
Patients.
too. If it's
I
health,
call them
some
neighbors
healthcare.
too, because I
Neighbors.
care
Oh,
about them
neighbors
because
sounds
they're
good.
in my
Yes.
Yeah.
community.
Yes.
So, and a lot of the other free clinics, we use it as neighbors because it is. I live in Jacks Beach, but I care what happens to someone on the west side or north side. That's my
We
community.
live here. We love it here.
Yeah, like
Yes.
that impacts the whole community because those are people, if they weren't healthy, they're going to use the emergency room, which increases all of our health insurance costs. So love being that resource for them. Our patients are the working uninsured. So they're adults. We don't see any children.
18 plus?
So 18 to
Okay.
64. So we want to fill a gap.
65 and older Medicare age.
Medicare.
Okay.
Yep.
Keep
Yep.
going. Sorry.
Yep. Yeah. No, love it. And then 18 and below, they can they're on Medicaid
Peds, yep.
or they can be through the Florida Kid Care Program. So we're just trying to fill a gap. We're not trying to duplicate or replicate anything. We get funds from donors, and I like to share with them that we're being responsible with your dollars by not duplicating.
The second half, we're going to hit that a lot. Who are the partners? How are you funded? All that stuff. But I like that. So 18 to 64, right?
Yes.
65 plus is Medicare age. Different programs, products. Under 18 is different. Let's see. What do we got? 3 minutes left to the commercial break. Some people, I just like saying it. We're not live, are we?
No, we're not.
We're not live. We're just kidding. We're live. I love this. So 3 minutes left before commercial break. Second half, all volunteers in medicine. What are you most excited for in the next 12 to 18 months? That's a tough question.
I am most excited for our clinic. We are looking at branching out and partnering with other groups to serve people where they already are going.
In the home.
So,
ALFs,
or
SNFs.
at
Oh.
another partner that maybe doesn't do what we're doing, but needs access to primary care and specialty care. So we just did a strategic plan, and our board said we need to look at how we can expand to either other locations, mobile units. And so that's been really fun to explore because we love partnerships and we love working with other organizations to kind of come together and be where people are already going.
Meet them where they are.
Meet them where they are.
Yes.
Yeah.
We're going to hit a lot of this stuff second half, I think. We love shout outs. Any shout outs?
So I will give a huge shout out to our city.
Yes.
I am really happy as not just a nonprofit leader that runs a free clinic, but as a taxpayer, that we are really trying to tackle this uninsured beast. They're really looking at how do we stop waiting till things are so bad and try to address it early. The city, which is wonderful, they give a lot of money to UF Health for the emergency room, for emergent care. We need that. But we also need to think about what are the organizations that we need to focus on that are preventing homelessness, that are preventing emergency room, preventing overdose deaths. Keeping people in their homes, keeping people with their cars. And so the initiative they've started, HealthLink Jacks, I think is wonderful. And the mayor and Dr. Joshi and Lynn Sherman, like they really want to make an impact, and they're also willing to put the funding with it. And so I really want to give them a huge shout out.
I like that shout out, by the way.
Yeah, it's a good one.
We live here. We love it here. Like, how do we disperse information, whether one person hears it, 100, whatever it is? This is where we live. How do we make this city a better place? Want to add something before we wrap it up?
No, you just a lot of good names there.
That was
It's
good
funny.
names.
We've interviewed a lot of these people.
I was gonna say, I know Dr.
I'm like,
Joshi.
all right.
We love
Yeah.
Dr. Joshi.
He's great.
That's what the hell just happened. Welcome back to the second half of What the Hell Just Happened. If you're catching us here on the radio, good news is you can catch the first half on your favorite podcast platform or YouTube under What the Hell Just Happened? That's what we're called. I can't keep track. Doesn't matter. If you're on the podcast, there is no commercial break because we don't have sponsors other than 212 Benefits.
Shout out.
That's our company, by the way. Trey, thanks for chiming in on this. First half, Volunteers in Medicine CEO here, Jennifer Ryan. She is hysterical. I would say smarter than us. That's our favorite. Like, the guest has to be smarter than us. told some personal stuff, journey of the company. Second half, we're going to go all volunteers in medicine, I think. What's coming up? Are there fundraising opportunities, partnerships? But before that, we got to do healthy or not healthy. You ready?
Okay. I'm nervous.
You don't have to be.
I'm not
You should be.
an expert.
Healthy or not healthy red wine?
Healthy in moderation.
I love red wine.
I love
Healthy
red
or
wine.
not healthy traveling the world?
Healthy.
Yes.
Yes.
Healthy or not healthy volunteering?
Healthy. Yes.
Healthy or not healthy competing with your husband in all activities?
Probably not healthy.
I'm going not healthy on my household. Healthy or not healthy, the city of Jacksonville.
Working to getting healthy.
I love that answer. We're going to pause that. You got one?
Do you mind if I ask why you think, like you're saying, what are some of the non-healthy factors of Jacksonville currently?
Let's forget healthy or not healthy. This is a great transition. No more questions. That's a great transition.
Just curious.
Getting
Like,
healthier.
where are we lacking right now?
So when we talk about Duval County, and I'll just kind of focus on Duval County because I feel like that's where most listeners will be living. We're right next door to, so we're 57th healthiest county in the state. Right next to the first,
St.
the
John's
healthiest
County.
St.
yeah.
John's County.
Yeah.
So, and when I say we're working towards getting healthy, there's parts of our community, they're so focused on their families, their job. They're not thinking about themselves. They're taking care of everybody in their household. They don't feel good. But they don't have time. Or they don't have the money to have health insurance. So they don't realize you need a primary care doctor. They don't realize you should go to the doctor that you need. Once you turn 40, you need to get your eyes checked. You need to get a mammogram. You need to get a colonoscopy to get colon cancer screened. So it's not that we're doing these things to make people healthy. It's just people don't know and their priorities are on so many other things. So that's why I love that the city is trying to educate. They're trying to get the word out about the importance of primary care, the importance of going to the doctor. And if we can, people just wait too late in their lives when things are already bad, when they've already had diabetes for 5 years, when they have an asthmatic episode and they need to go to the emergency room, when those things can all be managed with going to a primary care doctor with proper medicine, proper diet. So that's my take on it. We need to do more to get the word out to people about being healthy because they're just trying to survive. So many people in our community.
I love that, right? So healthy or not healthy, that's a great transition. You said it. How many counties are in Florida?
67.
67. Wow. What is Duval County ranked?
57.
So the criteria, Dr. Joshi talks about this all the time.
Yeah.
What ranks on those things to make us, in 62 counties, Duval County is ranked 57th in this state of healthy.
And it might have changed, but it's always around that
close,
range.
yeah.
So
This
don't
is
quote me on.
the most recent, again, within reason. Let's say it's 55 or 52 or 60, it doesn't matter. The number one county in the state for years is what?
St. John's County,
Which
right next
is
door.
a rock throw away from here. Why is that? A variety of Trey's saying money. Say money. You can say
It is. The more
It's
money,
money,
you
yeah.
have,
Say
where you live dictates your health, unfortunately.
100%, yeah.
Your zip code dictates how long you're going to live.
Average lifespan, comorbidities, access to health care,
And
social determinants of health,
it's
all
sad.
those things.
It's sad.
Go ahead, Trey.
Oh, I was going to ask, do you think there's a debate to be had of maybe we're not educating early enough? So these kind of conversations are just not being had in schools? Because I always tell Eric when you guys talk about primary care and all this stuff, like, if I didn't have a wife, I probably wouldn't be aware of half this stuff, if I'm just being brutally honest.
Tell the husbands out there.
I make all my husband's appointment and I'm like, you're going to the primary care doctor on Tuesday. And he's like, okay.
Yeah.
And because it's men, and that's another thing. 2/3 of our patients are women, and we're trying to get more men because men need to get checkups too. They need physicals.
You'd mentioned like 40s a year. I think starting at 30, you could have high blood pressure from 30 to 40 and not know about it.
Yep.
You could have pre-diabetes from 30 to 40, especially like what zip code do you live in? What's your diet look like?
Yeah.
Oh man, we're going
Do you
down.
think though the internet has allowed for people to maybe kind of wander down a rabbit hole they never would have? Like, so if you didn't know you had diabetes, but you're sitting there on Instagram or something getting dominated by diabetes videos, do you think the internet has sparked people's interest to maybe come to you sooner than they never would in the past?
Or avoid
I
you?
would think.
Oh yeah, that's a good point.
I think the internet is influencing people and their health choices. What I hear from people and why they delay, especially if you want to say diabetes, is they have a family member that got diabetes. They had to go to the hospital and they lost their foot, and so they don't realize it was because of that they didn't treat it quick enough.
For
they
the
just
10
think,
years prior.
I don't want to go because I don't
Yeah.
want to lose my foot. Not, I should probably go see what's wrong and maybe they can help me. And so it's just education for parts of our community. And so if we can start young, that's not a bad idea.
Yeah.
I wish I had. We give this. I call it an ace of hearts that we hand to clients, patients, prospects, an ace of hearts. So you advocate, you coordinate, and you educate. I think if you want to change healthcare, those three things move the needle more than anything. You are an advocate for the entire Northeast Florida region to be healthier, right? You are helping with coordination of care. So is HealthLink Jax, all those great people.
Yeah.
But the E, educate. The example you gave, the diabetic, so their dad, granddad, mom, grandmom got their foot amputated because they didn't control their diabetes. But you've had diabetes for 10 years, and you could avoid this entirely if you're checking your sugar, taking insulin if you need it, whatever the case is, making some tweaks on the diet, and that's what Volunteers in Medicine helps with.
Yes. So our volunteers, and they work with the patient. It's not you have diabetes, you need to do this now. It's, what are some things we can do? And so we provide them with devices to manage their blood pressure or blood sugar.
Glucometers,
So we
Lancets.
actually do the Libre, where they can get in real time on their phone. If they have something that's high in sugar, they can immediately see, ooh, next time I maybe only need 2 pieces of pizza, but I had 3, and that really impacted my blood sugar. So I'm gonna try to cut that back. And so, giving them the tools, and then instead of reprimanding them and shaming them, it's doing motivational interviewing to help them make choices that are right for them and their lifestyle.
#healthy. This is so the cost of the American healthcare system, which is, man, it's wild. We can talk about that. You're coming back, trust me, because we have so many things to talk about. You're meeting people where they are. Let's go back to who needs to know about this and walk in the doors and what services, because I wrote down all the specialties. There's a lot. Cardiology, dermatology, endocrinology, ENT, all the
ologies.
All the ologies. I love
all the
that.
ologies. But it's really the whole person. We want to take care of everything. And really, when we accept someone as our patient, we want to have all of the pathways that they need there for them. The worst thing that could happen is we get someone in, they need a major surgery, we have nowhere to send them. So we've built all these pathways with partnerships with the hospitals. They are amazing supporters. We all work together to make sure we have from beginning to end what someone might need. So our patients are the working uninsured. They can work at least 20 hours a week. And for one individual, they can make between $13,000 and $39,000 annually. Then as you add members of the household, you can make more.
I want to hit this. This is relevant, right? So if you work 10 hours a week and you're only making 13 to 20K a year, man, I need access to healthcare. Volunteers in Medicine. If you're working, what was the max number? 20, 30 hours a
For
week?
one individual, for the amount that they can make.
The max working hours per week.
It's more about the finances, right?
It's
the max
really,
salary.
Finances.
what they make.
So they're
Yeah,
working
what they
40
make.
hours a week, but less than, what was the financial number?
$39,000
$39,000.
for
Goes
one
up.
individual. But if they have a spouse or kids, they can
It
make
goes
more.
up. This is what to reinforce. If you work these many hours, if you're working in the service industry, if you're a CNA at a hospital system locally, under the 40-hour threshold, so many people have access to this based off of threshold of hours worked, financial means, and then as your married, spouse, kids, that goes up the financial number. So if you have a household of 5, that monetary amount is higher than $39K.
Yeah, it's a pretty good amount. And these are members of our community that live paycheck to paycheck. They have a job, they have a home, they have a car, most of them. They're taking care of groceries. And so if you threw in $600 a month, which is the lower end of how much insurance costs per month, it's definitely not what I'm paying for mine.
So say,
But,
we'll talk about that if you want. That's what
so
we do.
we can
Ugh.
take that out because that's a barrier to them getting care. And we really only need 2 months worth of pay stubs or a letter from their employer to qualify.
What's the industry that reaches out to you the most?
Small business owners, so people
Really?
that work in daycares or cleaning services.
Okay.
We had one woman, she advocated for every single person. She cleaned houses. Every single person on her staff advocated for them to come. It was mostly women. So she's like, you need to get your mammograms. You need to go get your blood checked, get healthy. And all the women were like, thank you for telling me this, because if they're sick, they can't come to work. They want to make money.
Yeah.
And so that changed my perspective. I was like, people want to make money. If you're sick, you're not working, you're not going to make money. So it's not only do employers want people to stay employed working for them, but the workers want to make money. So they don't want to be out sick. So they saw the value in having a doctor. Also grocery stores. So we have people from Publix, Amazon,
Publix, really?
Uber drivers, lots of Uber drivers.
Uber driver's
I
a
could
big
see
one.
that, yeah.
Think about it. You're working whatever hours.
One Uber doesn't offer health
$39K and
insurance.
less for one person. As you get a family and spouse, children, it goes up.
And bus drivers.
You know what happens in a lot of companies? I'm going to call our industry. So I don't know if you know this. 212 Benefits, our company, we do employee benefits. So we
And
work
so
with
you need to know about us for your people that
100%.
their employees can't afford to buy their plan.
100%.
You need to tell them about us.
Or we look at like the cost of things like this employee cannot afford this.
Yeah.
Absolutely. But all these people you see that just don't understand, then where do they go? If they don't have access to care, where do they go?
Emergency room.
Emergency room.
Yeah.
Which cost
All of
a
us.
lot more money.
It's like $5,000 a
and
visit.
who
is
typically
bad.
Minimum,
pays
yeah.
for it? The community and their taxes.
Community.
Yep.
Insurance companies, rates go up. Yeah.
How you mentioned
I
that you
know,
had
it's bad.
300 volunteers. How many people do you guys quote unquote like serve throughout the year?
That's a great
So
question.
this year we will serve probably 1,300 individuals
Wow.
over 6,000 visits.
Say it again.
So we will serve 1,300 individuals over 6,000 visits
Wow.
That's throughout the year.
throughout the year.
Okay.
Yes.
I don't math so good.
No, I don't either, but that's still a lot. It's a big
I'm
number.
saying
yeah,
that's
yeah.
crazy, right? So that 13,000, how many uninsured?
1,300.
1,300. Uninsured in Jacksonville, not working was, what was that number?
It's over, so the uninsured total is about 130,000.
Okay. That's 10X. You could have locations everywhere if the funding comes. That's a great transition.
Is that almost roughly like 10%?
That's like 10%,
Duval?
yeah.
Okay.
So think about
Jeez
this.
Louise.
This
And-
is where we live.
Yeah.
Go ahead.
We're not on a wait list. We want more people. So bring
You're
people.
ready.
We're ready.
Walk in the doors, sign up, come here,
Yeah.
check it out.
Go to our website and just fill out the application and we'll call you and make your appointment.
VIMJax.org.
Yes.
VIMJax.org. VIMJax.org.
Yeah.
5 years from now, what are you thinking? 3,000, 6,000 people you're
I
probably
would
serving
love
a year?
that. I would love that.
Nice.
I would love
Is
that
it-
because
is
we
it
want to
la-
help people. We've got quality care. We want to help
The
people.
specialists too. Again,
Yeah.
you're definitely coming back because we're just scratching the surface. Is it lack of awareness? Is it fear of showing up? Is it like I think of men like I'm good. I don't need this. Oh crap! I got to
It's
get
a
my
little
foot
bit of
amputated.
everything.
Yep.
It's a little bit of everything. As much as we market and we have a billboard and we're on radio shows and we've got Google ads, it's just getting the word out. And I think people think, how in the world could this be free? How in the world could
Yep.
I get health care for free? There's a catch.
Nothing's free.
Something's wrong. It's a federal government program. Like they're going to lose their funding. And we're not. We're not funded by the federal government. Private donations, the state and the city help us. It's just, it's really word of mouth is our number one. It's friends telling friends telling friends.
I want to talk about funding for a second before that. Like you do radio shows all the time.
I mean, I've done like some podcasts, none as big as this one,
That's
but
big. I was gonna say who's. I was
Not
gonna
as
say,
What's
popular
Eric's
as
mom's
this one.
one?
What's your favorite one to join so far? I'm kidding. That was the main question.
this one, of course.
Oh, I love it. Great answer. Partners funding. Because I went to the website. I could be right or wrong. Funding and list of donors. I could be missing some. Mayo, never heard of it. Florida Blue, never heard of it. Publix, never heard of it. The Players, Truist, City of Jacksonville, Feeding Northeast Florida. We haven't talked about food. Ascension St. Vincent's, Baptist, never heard of it. Brooks, Dolores, like these are people that are every year
amazing
helping fund this. These are large organizations that care about healthcare. How do people contribute funds that don't? Or,
well, in addition to this amazing support, I mean, the hospitals get what we're doing because they lose money on their emergency room all the time.
every time Bob walks back in that ER 3 times a week for a
And they need the emergency. We need the emergency
Yes.
rooms. We
Yes.
need them, but not for things that can be easily treated
Constipation.
that we can take care of. We
toe
can help.
jam.
We can help with that. Yes.
Yep.
Got it. So it's amazing to me, but they see the value in this, and I'm very appreciative of all of their support.
Oh no, you were just listing off all the things
I
that
like
people
saying
go to the
random
emergency
stuff. I used
room.
to work in the ER Baptist downtown, and we had a
Oh.
log of like funny things that people came in for.
I mean,
There's a lot.
my neighbors complain that everyone just comes to get a receipt to get out of work. Just hey, I need. Please tell me that I'm sick, so I don't have to go to work.
wow.
I'm like, and they'll
To
say
the
that,
ER.
yeah.
Yep.
Isn't that crazy?
Oh, wow. I never
Cost
heard
us
that.
like
You know,
$5,000.
Dr. Thompson with Telescope. Or
Yes.
Paul, yeah.
Yeah.
We like to tell funny stories about the ER because
Yeah, he's an ER doc. Yeah.
it's a mess.
He did a great job during COVID. I think it's amazing. He did a lot of stuff telling the stories
Yep.
about COVID, and I think it's wonderful what he's done as a physician.
I love the city of Jax is tied to this part of this because we live here and
Yeah.
like, look, when I leave here, if I get hurt or injured or sick, I know what I'm doing. I feel pretty comfortable in the financial means to pay that cost. But there's a lot of people in this city that don't have either one of those.
I know.
Volunteers in Medicine, VIMJax.org.
Yes.
I like keep saying that. Partners. So how are you, do you have fundraising events? Is it year rounds? Because again, that list is even longer of partners.
Yeah. So
We Care Jax is a big one.
Yep, they're an amazing partner. So when it comes to funding, the biggest thing is we don't need to operate with a huge budget because we use volunteers. So while we'll provide $6 million worth of care, I really only need to raise about $2 million.
Lean and mean.
So it's thank you to the volunteers.
Yes.
It's amazing. Yes.
Yeah, shout out
I want to show up
volunteers.
once a month as a nurse because I miss touching patients, but that sounded weird. Like helping
You can.
patients,
I
not
know.
touching
You mentioned that. You
patients.
should. The city is a huge supporter of ours. We submit the public service grants that they do. We've got a direct appropriation for our West Jacksonville clinic, and we also have funding to do opioid abuse prevention. So we're doing primary prevention too. We don't prescribe opioids, but we're doing all the evidence-based things like yoga, mental health counseling. We're doing
Equestrian
equine
training.
therapy.
Oh, wow.
Yeah, the things that have been
Yep.
proven to help reduce stress, cope and manage your stress and your anxiety. We're also a part of the Florida Association of Free and Charitable Clinics, so we get funding from the state through that association. And then those are kind of our largest funders. And then we have an annual event called Women with Heart, where we honor women in the community, 8 amazing women that have made an impact either working in the healthcare field or fundraising outside of their work. And then they help us kind of raise awareness and funds throughout the year. And then just private donations that we get from supporters that have been around that are tied to our founders or just through, and lots of grants.
All that's good. Man, we're almost out of time. So,
Wait, jeez.
Dottie Dorian,
Dottie.
did she help start this?
So Dottie is one of our co-founders. So Dottie is a retired nurse. And
She
Dr.
had the
Jim
gym
Burt.
at UNF. That's
Yeah,
what I'm
shout
asking.
out.
Right? When we went
Yeah.
to UNF, the gym was the
Yeah.
Dottie Dorian gym.
Yeah.
She's also done a lot for community hospice as well and is supporting their pediatric hospice unit, which is amazing. She's an amazing human. But she and Dr. Jim Burt, who is a urologist at St. Vincent's, they're both still around and as involved as they can be. They're trying to truly enjoy retirement.
Yep.
But they saw that we're part of a national model, and so they were retiring but wanted to give back and help. And it was right about the time employers were not mandated to provide health insurance benefits. So it all just kind of coincided at
Perfect
the same
storm.
time. And they saw people were going to the emergency room for diabetes, for like things that could be managed with primary
Constipation and toe pain.
care. So, yeah.
I keep saying that. Sorry, that's a weird. I got 2 eye rolls over there. If I don't get at least 1 eye roll, I didn't say something wrong.
That's right.
So I love numbers. You said this. You're running a $6 million location on a $2 million budget, right?
Yes.
Could that potentially be a $6 million budget running a $18 million location?
That sounds great. Yeah.
I mean, again,
let's do it.
that's
I
the
want to
goal.
do it.
Let's go.
Yeah.
We'll make it happen.
Yeah.
I might not.
I think this
Not yet.
podcast is
This
going
is
to make
it.
it happen.
Hey, we're
I
going
can
to the
hear
moon after this.
I can hear the millions
Yeah.
coming in.
wallet's empty.
Vimjacks.org/donate. I can hear them coming.
Jacks.org/donate. Anything to wrap it up?
Yeah, just a quick question. Around the state of Florida, are there other, like, let's say Leon County, I'm biased because I'm from there. Do they even offer this kind of service there? They do.
Yeah, so our
Okay.
Florida Association of Free and Charitable Clinics, I think the last time I looked, there's 90 clinics
Wow.
around the state. Yeah.
Shout out Florida.
And we all get together, we learn from each other, we do regional where we all try to help and learn and provide the best care that we can, and we're all helping each other.
Love it.
It's awesome.
Completely unrelated before we wrap up. Do you enjoy karaoke?
Only because you heard me singing earlier.
What's the 2
I
or
do.
3 songs you're like, put this song on, I'm going to crush it?
So my very first karaoke song ever was These Are Days by 10,000 Maniacs. It was my high school theme song, which I'm dating myself, but that's okay.
Danny's over there like, I have no idea what that song is.
It's the happiest song. And then recently, my go-to song that my friends will put my name in without me even knowing it is Valerie by Amy Winehouse.
Oh, I
It's just
love
a happy
that song.
And everybody likes it. It's
Oh.
enjoyable.
And
It's
you'll roll
easy
up,
to sing.
Your
It's
friends
easy to
show
sing.
you up, you roll up there and
I'll
let
just
it
hear
rip.
my name, and yeah, they just sign me up for it.
Healthy.
It's fun. It's fun. It's healthy. Yeah.
Wow. CEO of Volunteers in Medicine, 2 questions. Do you have fun?
I had fun. I think I laughed.
Would you
a
come
lot.
back?
Sure.
Okay.
Yeah.
He'll get a good picture of you smiling and laughing. We try to make someone laugh. You crushed it. That was a blast. Volunteers in Medicine, Vim, V-I-M, Jacks.org.
Yes.
Throw a /donate if you want to throw some money
Sure.
at it.
Sure.
That was a blast. I had fun.
Thanks, Eric. That
That's
was
what the hell
fun.
just
Yeah.
happened. Dang it.